Action.
You guys suck! You got nothing! Otherwise, what is it?
Order in the court. We're going to begin case number 5 Center versus the brain versus the body. The plaintiff, the brain, is trying to get a transplant from the body. Let me just start off by saying what we do know about this situation, then we can get to the bottom of it. The patient came into the ER November 21st, 2010 with shortness of breath, jaundice, and chronic back pain. The patient has a history of COPD, hepatitis C, non-Hodgkin's lymphoma, and jaundice. While at the hospital, the patient was diagnosed with hemophagocytosis, cellulitis of the right upper extremity, hepatosplenomegaly, a sludge-filled gallbladder, bacteremic thrombophlebitis with a fever of 102.1 and pressure ulcers in the sacral area. This patient is a full cold, no known allergies, and no past surgical history. Brain, please state your case.
After all that, are you kidding me? This body sucks. Good for nothing. I want out.
Okay, well, it doesn't work like that. You still have to state your case and tell me what is going on.
All right, fine. As the brain, I am the CEO of this unit. I tell everybody what to do, when to do, so we can perform at an optimum level. But I have a few basic requests: blood, oxygen, and good housekeeping. How can I function without those things? First off, I need oxygen. Lungs, you have one job. Breathe.
What? How dare you? I only bring air in. It's someone else's responsibility to bring it to you. You should talk to the cardiovascular system. Besides, I have swimming pools of fluid in my basement that's starting to grow stagnant and change colors.
Not my problem, but valid point. Cardiovascular system. What's your excuse?
I'm doing the best I can. You know, when we have a systemic infection, I can't help but dilate my vessels. I have since miraculously overcome that hurdle and brought our pressures back up.
Sure, the pressures are normal, and yeah, maybe I'm being perfused, but still, there's no oxygen. How do you explain that, Houdini? You no good for nothing piece of shit.
What did you call me? With this hemophagocytosis syndrome, our hemoglobin is being broken down within the bloodstream, so oxygen cannot bind for transport for me to get it to you. You're not the only one that has problems, brain. With this fever, I'm boiling.
That's what I do. You weaklings let infection in. Somebody's got to try to do something. I burn them out. I turn that heat so high up that they can't survive for 1 second. And not to mention, skin. Speaking of infection, you make a better piece of Swiss cheese on a hoagie than you do an anatomical barrier. You let everything in.
Sure, if I had the proper building materials, I need a good blood supply to overcome these wicked stage 2 pressure ulcers that I have on my sacrum. And if I'm not hydrated by the blood supply and healthy enough, what am I supposed to do without my nutrients? And I could probably fix these holes if I could get some protein. Gut, hello? And if the musculoskeletal starts moving and gets me off my butt to give these wounds a break, that would be helpful too. Lastly, just look at me. I'm all yellow, and these legs of mine are swollen like Italian sausage.
Gut, you got some splaining to do.
Do you realize I have Hep C? That's causing me not to be able to focus on my job of being a filter to remove toxins in blood and regulate hormones and produce digestive liquid called bile, which because of my gallbladder being all sludged up, it isn't releasing into the intestines to do its part in digestion. Now my gallbladder is forming crystals and salts, and it's all messed up. This liver of mine is busy. Not only do I have to do all those things, I have to be responsible for bilirubin. How can the liver keep up with clearing blood of bilirubin and secrete it into bile that goes to my intestines if I have reduced hepatocyte uptake and impaired hepatocyte secretion of bilirubin?
But the skin makes a great point. How is it supposed to rebuild with no protein? And that goes for the rest of us. Protein is a fundamental building block. If you're not processing it and delivering it, what are we to do?
Huh. You could be helping more by avoiding high intakes of protein, which is increasing the ammonia levels you're complaining about, you nut bag. Good dietary choices would be nice, Mr. McDonald's. Do you want to biggie size it? How many times have I heard you say that? And yo, get off me. Why don't you talk to muscles over there?
Everybody knows I'm controlled by the brain. I haven't been able to move in weeks. Every time I try, the brain shuts me down crying. When? You want some french fries with that wham burger?
Me? I'm getting the back pain signals from you.
Oh, Brain, come on. We all know that non-Hodgkin's is the culprit here. It's been causing us chronic back pain for months now.
Oh, yeah, but you're a real piece of...
Okay, now that we've heard counts from the brain and the body, I call Nurse Nicole to the stand. Please come and give us a testimony of everything that's going on.
So it's clear from the testimonies that this case is very complex, but I've done everything for you. For your impaired gas exchange, manifested by your extreme shortness of breath, I gave you 4 liters of oxygen, chest PT to help move secretions, maintain the head of the bed at 30 degrees, and turned you every few hours. I also gave you prednisone, levobuterol, Tamiflu, Advair, and Subriva.
Well, clearly, all the hypoxic issues are being dealt with, Brain. This complaint is dismissed. Please come with the next one.
Next, about your fever related to your infection, shown by your temp of 102.1 and blood count of 0.4, I gave you 325 of Tylenol to help because of your impaired liver. I also gave you cyclovir, Bactrim, and fluconazole. As for your miraculous fix in your blood pressure, yeah, that was me. I gave you fluorocortisone to help increase your blood pressure.
Girl, you're doing good. Killing 2 birds with 1 stone. BP and fever all in 1 shot? Look out, Brain. You lost this battle. Come on with it.
Liver function is your next problem. You manifested with jaundice related to the Hep C. I've given you all your antivirals so far, so now I had to fix your symptoms. So you need protein for healing, but this leaves you with increased ammonia levels. So to counterattack that, I gave you lactulose. To help with your stage 2 pressure ulcers, I turned you every 2 hours, decreased friction and shear, checked for moisture, and encouraged you to get out of bed throughout the day. I also topped it all off with ProShield to help with wound healing.
Wow, that's definitely gotta be it.
No, there's one more. So for the acute pain you complained about, I treated it with Percocet, fentanyl patch, and the last part of that cocktail was gabapentin. Evidence-based practice shows that gabapentin added to an opioid helps decrease cancer pain. Now I'm finished.
Thank you for that. But I still feel like a big pile of...
Yeah, it takes time, but remember when I also got you a wound care nurse, PT and OT, a nutritionist, and case management. You will get better in time.
Truly a compelling argument has been made today by the Brain, but clearly it was dismantled by Nurse Nicole. Thanks to her superior nursing interventions, every argument that has been brought up by the Brain, she has treated. In closing, Brain, your request to be transplanted is denied.
Ha!